There's been a lot of talk on high deductible health savings accounts. I haven't had one. I think they're wonderful. Is there any discussion in the new bills about health savings accounts, or is that just one if you have it, you can keep it?
I think that's on the if you have it, you can keep it type side. With most of the healthcare legislation, they're not looking to get at the people that have company provided plans. The big area that they're going at is a small employer and how to get them to supply or keep providing a healthcare plan, and the other is for individuals that either can't get on it or can't afford the plan. So a lot of this is based on how do you get those people that are trying to find plans because their employer doesn't provide one, and get them covered more so than what we've got with the company employed in providing plans.
I have two questions for Linda. One, what do the employees have to submit at the end of the year? Do they actually have to submit their expenditures to the IRS, their receipts?
My understanding is they have to have those available. If they put it down on their tax information, that information has to be available. I do not know for sure if it has to be submitted along with it or not.
Okay, and then my second question, I know CAS is doing 50% of the high deductible automatically. Can you offer that as a matching, where you will match up to 50% of the high deductible if they put in that amount?
We did not want to go in any direction with the matching. We just felt that we needed to stand up and, give this dollar out there, not focus like a 401k matching program, but because it was quite a change on the incentives too. Just to let you know, the first year we put these contributions in over the first 3 months of the year. So January 1st, February 1st, and March 1st, 1/3 of the contribution goes in. Now, for 2010, it's going to be over a 5-month period. But that first year, we needed to have the dollars go in right away in case there was the need for the dollars.
You talked about the co-op model for healthcare. What was the key message you tried to get across?
I think the key message is that we ought not dismiss the notion of having consumer-owned and operated healthcare plans provided by cooperatives as part of this debate. I understand that they work in other parts of the country. There are some very successful models out there. And if we put our minds to it, I think there is ways that we can say this works in our part of the world as well. It isn't something that's on the forefront of people's minds because most of us as rural electric employees do have very good health insurance, and nobody's saying that any of that will go away. But I think those leaders like Senator Conrad that have proposed this option are doing so with the best interests of the country in mind and trying to get to a better place, and cooperatives could play a role in that.
Okay, you talked about the major bills in the House and Senate. If someone wants to monitor these bills, how can they do that?
A good website that I've gone to is called the Kaiser Family Foundation. It has a document on their site that will do a side-by-side comparison of all the bills. And it's a summary. It's not a very legalese type format, so it's pretty easy to read and understand what each provision has or each bill has for provisions on that website.